So we watched our cases fall and fall and fall all the way down to one inpatient 2 to 3 weeks ago. And since then, we've had a slow accretion of cases suggesting yet another new phase to the pandemic. Is this the endemic phase? Is this a mini surge? Most experts think a big surge is not in the offing, but we're certainly seeing a steady increase in cases here at Ellis. We currently have 11 patients in the hospital. In contrast to the last time we spoke, we now have 2 in the ICU and 1 who has been placed on a ventilator. So a couple of very serious cases have entered. Another feature of the current census in the hospital is those so-called incidental cases, where patients admitted for other diagnoses, not suspected having COVID disease, are actually found to be COVID positive and need to be managed with those special precautions. Well, the CDC has looked at how we look at risk in terms of COVID, maybe in a different way, above and beyond just case counts. And so they've created a metric called the community level, which is based on hospitalizations, the number of cases per 100,000 population, and available hospital beds to come up with a score that essentially measures the impact of COVID on our healthcare institutions. And that impact on acute care hospitals in particular is one of the most critical things we have to keep in mind. So, yes, in Central New York and in the Southern Tier, there are counties which are deemed high community levels, that is high risk of transmission, and perhaps high risk of impact on acute care hospitals. They're not far away, and we have seen in the capital region a couple of counties rise into the medium risk level. So therefore, I think we have to be very cognizant of the fact that COVID-19 is still present in the community, and particularly with our high-risk folks, we need to be careful to protect them, whether that's masking, whether that's social distancing, perhaps in a conservative fashion, perhaps even above and beyond the CDC community level. Just to review a little bit, the CDC community levels divides our counties in the U.S. into low, medium, and high for COVID-19 risk. In those counties that are low risk, one is advised to mask related to personal choice, and perhaps when very high risk, to consider consulting a physician about what one individual should do. In medium risk counties, all high risk folks, and that includes everybody over 65, should consult their physician about how to utilize masking and perhaps other measures to protect themselves from COVID-19. In the high risk counties, like some of them in Central New York and Southern Tier, all of us should be masking still in indoor congregate settings. And we just have to watch how the situation evolves such that we do best practices. I am myself conservative, and I do mask in large public gatherings, indoor congregate settings, even though we are a low-risk county. So just to reiterate, we still in Schenectady are at low risk. We are adjacent to high-risk counties, and we know that the subvariant of Omicron, I'm using some lingo there, the BA2 variant is probably dominating us at this point in terms of the percentage of COVID illness out there. So we need to be conservative, and I kind of tend to be conservative about at least masking up in indoor congregate settings. We also need to be aware that when we test positive, there are excellent therapeutics available for anyone who's in a high-risk category as long as they're identified early, and also be cognizant about the latest vaccine recommendations, which are still evolving, especially with a 4th dose. Those of us who have not gotten a booster should get a booster, and of course, those who remain unvaccinated, I strongly recommend getting the vaccine. This April, obviously, we have, I think, a trifecta of religious holidays, which means many family gatherings. I observed here in Schenectady, going to Mass, a large group of unmasked people. And I had a gathering at my own home where we asked everybody to get home tested before arriving, but then we did not mask. So, a very high-risk situation, a medium-risk situation, I think we may be in for an uptick in 2 to 3 weeks from today. But we will see. COVID has thrown us lots of curveballs, and it has been very hard to predict.